We took over the practice. It wasn't a great idea from a business standpoint. It was the largest abortion clinic on the Florida Gulf Coast. We negotiated with the physician. We took over that practice in 1999, but it was actually after church on a Sunday when I went to the office, and the abortions were performed up on the second floor of the building, but I had never been up there. So on a Sunday afternoon after church, for the first time, I walked up those stairs.
Dr. Bill Lile is a certified OB/GYN who, in 1999, took over a practice that was the largest abortion provider in Florida. He stopped abortions on day one and now uses the equipment to lecture people on the barbarism of the practice. He is a licensed medical practitioner in Florida and Alabama and an instructor at the University of Florida. He's known as the pro-life doc, and he joins me now. Welcome to SPUCTV. It's a joy to have you.
Well, it's an honor to be on different sides of the pond, so it's
Different
an honor to partner with you.
Right, so to start off, just tell us a bit about your story, about how you got into pro-life activism.
Sure. Well, first, I am board certified in obstetrics and gynecology. Undergraduate studies were at Rutgers University, and medical school was at the University of Medicine and Dentistry of New Jersey. And after I completed my 4 years of residency training at the University of Florida, the question is always, well, where should I practice medicine? And God led us to a practice in Pensacola, Florida. We took over the practice. It wasn't a great idea from a business standpoint. It was the largest abortion clinic on the Florida Gulf Coast. We negotiated with the physician. We took over that practice in 1999. We had him sign a non-compete where he couldn't practice any medicine for the next 2 years. And on day one, we stopped all abortions and abortion referrals. So now for 200 miles along the Florida Gulf Coast and the Pensacola region, we still do not have a single abortion provider. But it was actually after church on a Sunday when I went to the office, and the abortions were performed up on the second floor of the building, but I had never been up there. So on a Sunday afternoon after church, for the first time, I walked up those stairs, and I couldn't help but think how many thousands and thousands of moms had walked up that same set of stairs, had spent 20, 30 minutes upstairs, went down the other set of stairs, but when they went down the other set of stairs, they were no longer carrying that baby in the womb that they had carried up the stairs. At that point in Florida, you could legally perform an abortion just like most of the EU. You could perform an abortion up to 24 weeks gestation. Meanwhile, we had babies at my hospital in the NICU that were surviving after being delivered at 23 weeks. We had protection for baby sea turtle eggs that were left over on Pensacola Beach, where if you just disturbed a baby sea turtle egg, you could face $100,000 fine and up to a year in jail. And how is it that we can legally kill a baby which could survive on the outside, that we treat in the womb as patients at our high-risk center? But meanwhile, if you harm an eagle egg or a turtle egg, you could spend a year in jail. So we just wanted to educate. We educated on what happens at that moment of conception, how we're created in the image of God, how we are using tools of modern obstetrics to diagnose, treat, and even cure babies in the womb. We're now at my hospital, we're giving life-saving blood transfusions to babies as early as 18 weeks gestation. And you're doing the same thing in London, saving babies' lives and even performing surgery for spina bifida corrective surgery. So the states have great rules and laws to protect the rights of patients. And even in the UK, you have rules that protect the rights of patients as far as access to care, being respected, and quality of care. But if they are a patient, they are a person. If they are a person, they deserve protection. So we are here trying to educate that this is not an amorphous blob of tissue inside the womb, but this is a person, this is a patient, and we want to give them the protection that they deserve.
So is that, regarding your clinic then, is that mainly what you do? It's about educating and about saving children? Because to most people, when they hear of a clinic like that, they'd think of abortion and they'd think of contraception. So who is it you actually serve?
Well, I practiced and delivered babies right in Pensacola, Florida for over 30 years, and I delivered over 5,000 babies during that time. And I was a full-time obstetrician gynecologist until I turned the age of 60. So then we really felt called to educate people. So now we had been speaking around the country and really around the world on the issue of patients' rights in diagnosing, treating, and curing babies in the womb. So we took a sabbatical from the practice of medicine. I'm board certified, licensed in multiple states, but we took a leave of absence to defend my patients in the womb. And so our organization is actually called prolifedoc.org. And between now and the end of the year, we'll speak at over 40 different events just here in the United States. And we just started a university tour where we are taking this information to universities because they've really been deceived. I would say, as we're touring and speaking on different campuses, the majority of the college students think that you can't even see anything inside of the womb until about 20, 24 weeks gestation. But when we use the science and we can show them how a heart is actually beating 22 days after conception, that all the systems are laid down, we just want to try to give them the true science and the true facts so that when they do make a decision, at least it's an educated decision, because patients have rights. And a lot of people don't even realize how we are diagnosing, treating, and curing babies. And it's not just blood transfusions. We're correcting spina bifida corrective surgery. We're doing open heart surgery for babies in the womb, where the babies actually have their own IV in their hand and they're receiving IV fentanyl for pain management and a paralytic called Norcuron. We're doing vascular brain surgery, stomach surgery, and even diaphragmatic hernia surgeries. So if they're a patient, they're a person and they have rights. So we just want to let them know what the truth is so they don't just think, well, it's not even a patient until it's delivered. Because even when we do open heart surgery and remove tumors from babies' beating hearts at 27 weeks, those babies don't go to the recovery room. They actually go to the recovery womb, where they can heal and recover still inside of their mother's womb for 10 weeks. And the particular baby at the Cleveland Clinic wasn't delivered until 37 weeks gestation after having open heart surgery performed at 27 weeks gestation.
This is excellent. So since you've been, doing your work as the pro-life doc, and since you've opened your clinic, have you been shunned by a lot of other obstetricians for holding to the value of the preborn person?
I think that there's a definite dislike, if not even hatred, towards the information that we're providing. We're actually also being very involved in educating about the dangers of the abortion pill, but the science of abortion pill reversal. It's like, reversal? Yeah. We have now documented over 8,000 times that our network of physicians coast to coast here in the States that have been trained in the science of abortion pill reversal, we've documented over 8,000 babies whose lives have been saved. Well, and our critics will say, well, that's impossible to do it. Well, I've attempted it 28 times and I've been successful 22 times. And we use antidotes in medicine all the time. If somebody makes a mistake and they take too much of a narcotic, such as fentanyl, they are going to often die. But we now have the antidote, and the antidote is called Narcan. Narcan is available without a prescription through Amazon. You can even give it as an injection or even as a nasal spray. And it's the antidote when somebody makes the mistake of taking too much of a narcotic. We have the antidote when somebody regrets the decision that they made and are looking for help when they've taken the abortion pill, because the abortion pill will 98% of the time kill that baby in the womb. But we have about a 72-hour window where the abortion pill was attacking and decreasing a very important hormone called progesterone. And progesterone, it's a big word, but it just really means this is the progestational steroid hormone. Everything that's good about a pregnancy as far as continuing the pregnancy, relaxing the uterus, providing more nutrition is all managed by the hormone progesterone. The abortion pill attacks and blocks that hormone. So progesterone levels were going up. Somebody makes a mistake, they take the abortion pill, and then progesterone levels start to go down. When a woman contacts us and she has regrets, we can just give her progesterone to bring those levels back up. And we use progesterone in normal obstetrics all the time. If somebody has a history of miscarriage, we can give her progesterone to keep the pregnancy going. Somebody has triplets or quadruplets, and I've delivered both triplets and quadruplets. When she has triplets or quadruplets, often we will give her progesterone to keep the pregnancy going and get the babies as far along as possible. When a woman has IVF, in vitro fertilization, which is a whole nother topic, but if a woman goes through IVF, her body was not expecting embryos to just sort of show up as uninvited guests. She wasn't ready. Body wasn't prepared. So standard, after embryos are transferred into her uterus, it's standard of care to give her progesterone to keep the pregnancy going. So, but we have now done that 8,000 times. And I don't know why there is such strong hatred from the pro-abortion community. And it's not just a couple of us. We have a group called the American Association of Pro-Life Obstetricians and Gynecologists. We are licensed, board certified, extremely experienced. I was an instructor with both the University of Florida and the Florida State OBGYN residency programs as an instructor. So we are knowledgeable, but we have over 8,000 of us that are members of APLOG, which are very different in our thoughts and values compared to ACOG, which is incredibly pro-abortion, wants to make the abortion pill even more dangerous despite its dangers. And there's even now a fellowship. And if you or your listeners don't know what a fellowship is additional training after you go to university for 4 years, then medical school for 4 years, then 4 years of residency. You can participate in what's called a fellowship. And a fellowship is additional training. You can do a fellowship in GYN, gynecologic cancer. You can do a fellowship in infertility. You can do a fellowship in high-risk obstetrics or even urogynecology. Well, there's a fifth fellowship now where you spend 2 years and you learn two primary skills: how to perform an abortion after 24 weeks gestation up to term, and then how to perform what is called a selective reduction, where, say, a mom is pregnant with triplets, and you might be concerned about preterm labor. And I've delivered healthy triplets and healthy quads. But if a physician or a mom are concerned about preterm labor, they actually will teach the physician how to look at all 3 or 4 babies in the womb and then pick baby A or baby B, guide a needle with ultrasound through the skin of the mother's belly, through the wall of the uterus, go right up to baby A or baby B's chest, and then pass the needle right into their hearts, and then inject them with either potassium chloride or with a heart medication called digoxin, essentially killing 1 or 2 of those babies. But when we now have a fellowship where you spend 2 years after you are a highly educated, highly trained person, but then to desire, and we now have 39 of these programs here in the States, where you can spend additional time really learning 2 skills: how to kill a baby at the end of the pregnancy and how to reduce the number of babies that are in a womb at one time. So it is evil. If we can diagnose, treat, and cure babies in the womb, that is very, very good. But when we are killing babies that could have survived on the outside, that's bad. And are there reasons medically where sometimes we need to deliver these babies? Absolutely. Moms can develop conditions like severe preeclampsia. Moms can develop conditions like cardiomyopathy, where the mom's heart is not beating as well as it should, and she can actually go into heart failure, liver failure, and kidney failure. Well, the solution is not killing the baby. the solution is maternal fetal separation. Let's have the mom get cared by the mom's doctors, and let's have the baby be cared by the NICU, by the neonatal intensive care unit. So it's the separation of the mom and the baby that saves the life of the mom. It's not taking the life of the baby and stopping the baby's heart. And we have now had babies which have survived here in the States as early as 21 weeks gestation. There was a baby in Iowa that was delivered at 21 weeks and 0 days, and the baby only weighed about 10 ounces. That baby went home and is doing well. Another baby was born at the University of Alabama, Birmingham, only weighed 14 ounces at 21 weeks and 1 day, and that baby also went home. So separate the moms and the babies. Yeah, sometimes that is the right thing to do to protect the life and health of the mother. But the killing of that baby, stopping of that baby's heart, doesn't help the mom. Now, if a baby is delivered prematurely because of a medical condition, when we do everything we can, even a baby born at 24 weeks will only survive about 70 to 80% of the time here in the United States. But even if that baby does pass away and we can't save the life of that baby, that mom will always know she did absolutely everything within her power to save the life of that baby, which by a medical emergency was affecting and threatening her own life. So we don't just have one patient when I have a pregnant patient. I actually have two. And if she has twins, I've got three patients. When I followed and delivered quadruplets, I had 5 patients that came to the office every day. All patients have rights. We try to save the lives of all patients, whether that is the mom or her baby or babies on the inside.
Well, I mean, I've heard you saying here, I mean, all of these stories are excellent, and it's something that I've kept hearing you say as a patient is a person. And it very much seems like the point of your ministry is to educate people that the unborn child is alive because the unborn child can be a patient. But do you think that abortion culture is actually fed by people not understanding the person of the child? Or is it actually more malicious than that? Is it that people understand the life of children in the womb and still choose abortion?
Well, they still choose abortion. I mean, recently here in the U.S., we had a case of a man and a woman who, when they found out they were pregnant, they were ecstatic and celebrating and having gender reveal parties. And then just this past week, they had additional testing done on the baby. And at about 21 weeks gestation, when they diagnosed the baby as having Down syndrome, no threat at all to the life or health of the mother. It's just that this baby was not perfect. And I've delivered babies with Down syndrome. I have patients and I have friends, and I know adults with Down syndrome. These are amazing individuals. We recently had a gentleman with Down syndrome provide expert witness testimony here in the United States before the House of Representatives on Appropriations Committee bill. He received a standing ovation, but one of the lines that he used to start his talk was that I am a man with Down syndrome and my life has value. I mean, God forbid we use technology to find out whether the baby is as perfect as you are, or not just if this is an amazing individual, but if you even want this baby. And now we even have people that are posting video where they get a gender reveal party and this blood test, this gender reveal test called a panorama test using technology called cell-free DNA. It is more than 99% accurate, not only on diagnosing dozens of different conditions, but also on determining whether it is a boy or it is a girl. And sadly, this test can be done 7 weeks after conception, and it's sensitive more than 99% of the time. Yet a lot of people are getting that information, using that technology and saying, oh my gosh, it's another girl. I don't want a girl. There are people who are actually posting videos of themselves celebrating that they are taking the abortion pill. They're killing that baby in their own wombs just because it wasn't the gender that we wanted. So if we are killing babies because it's not a boy or it's not a girl, that's not just about healthcare. This is really evil. This is demonic. And when some things don't make sense, you have to think, is there a spiritual component to this? And I, coming from a biblical worldview, Absolutely, there's a spiritual component to this. Why? Because we are Genesis 1:26 says that we're created in the image of God. We reflect that image of God. Abortion at its core foundation is an attack on that image of God out of a hatred for God. I know in the UK, you hate when you see the flag burned, just like here in the States, we hate seeing the American flag burned. Well, why does somebody burn the flag? Somebody burns the flag because the flag is the image that represents the US or the UK. Why would somebody burn it? Out of a hatred for my country or your country. What is the baby in the womb? The baby in the womb, God tells us, not my theory, God tells us, is created in the image of God. That's not on their birthday. My birthday is June 20th, and I'm going to celebrate birthday number 61, but that's not when I was created in the image of God. Because as an obstetrician delivering over 5,000 babies, I have a lot of control as far as when we would want to do a repeat C-section or deliver a baby. I can't say, well, let's do it. Let's deliver your baby on Thursday, and that's the day that your baby's going to be created in the image of God. No, we're created in the image of God, genetically unique from the other 8 billion people on the planet. Half the time at that moment of conception, half the time it's a boy, so different gender from the mom. But that baby, even at that moment of conception, is genetically unique from mom and dad. Babies and moms can even have different blood types. I mean, mom and baby do not share blood. Moms get all the nutrition to the baby, and baby receives all the nutrition across the placenta. But sometimes we even have to do blood transfusions for babies in the womb because a mom might not want to harm her body, her baby, but her immune system, the antibodies can cross the placenta and start to attack the baby's blood count because it's a totally different blood count. It would be like giving a blood transfusion to somebody with a different blood type. So what do we need to do? The only thing we can do when a mom is attacking her own baby is number one, deliver that baby and get that baby out of that environment. But what do you do if you're only 17 or 18 weeks? No baby has ever survived after being delivered that early. So we actually will guide a needle through the skin of the mom, through the walled uterus, and then with blood that you might have donated at a local blood drive. If you have O negative blood, we can take your blood, put it in that syringe, guide it with the needle, and directly through the umbilical vein, give that baby a life-saving blood transfusion. But this is not about healthcare. This is an actual hatred. And the number one reason why people will choose an abortion is just out of convenience. They just didn't want that baby at this time. They're perfectly willing, more than 99% of the time, to participate in intercourse, but they don't want to have a baby. But even if tragically a woman becomes pregnant after a violent act like sexual assault and rape, it doesn't mean that the baby is guilty. I mean, yes, investigate, prosecute, and punish these men to the fullest extent of the law, but we don't punish a child for the sins of their fathers. If you look in a crowd, if we have a large crowd that comes to an event, I know that some of those individuals, some of those students were conceived in rape. And then when we get that question, I'll ask us another student, say, there was somebody here that was conceived in rape and their father is a rapist. Just look around and tell me which individual that was. He can't do it. So there is no difference. They are individuals, and we don't punish them because of a horrible sin committed by their rapist father. But we're just using the tools of modern medicine to help people realize that these are patients of value. But in the bottom line, somebody who comes from a biblical worldview, I really see this as a spiritual attack. Especially since the abortion pill was released and created by a man named Etienne Emile Ballou. Worldwide, we have now had 1 billion abortions, and the abortion pill will kill a baby 98% of the time up through 12 weeks gestation. There are 1 billion people that had hearts that were beating inside the womb that are now dead because of the abortion pill. And that is the primary mode of abortion here in the United States. About 70% of all abortions are performed with the abortion pill. It's not available over the counter, but it is available mail order, even in states where they're trying to prevent that. But in Europe, the abortion pill in some countries in the EU, they might be 80, 90% of all the abortions are performed with the abortion pill. But the abortion pill, as it's being used now, we have a large study that came out that shows that the abortion pill is dangerous for moms as well. This particular study was released on April 28th of 2025. It had 865,000 women that were enrolled in this study. And they looked at their insurance information. They looked at 865,000 women who had been prescribed the abortion pill, and then they followed them through that same insurance information to see if they had any complications. We were told that the complication rate from taking the abortion pill would be less than 0.5%. So a little bit over 4,000 people should have had an expected complication. What was the reality? It wasn't 4,000. It was over 90,000. 10.93% of all the women who were prescribed the abortion pill had either a severe or a life-threatening complication, whether that was hemorrhaging, whether that was infection, sepsis, having to have an additional surgery. There were even over 3,000 women who had a tubal or an ectopic pregnancy, because when you receive the abortion pill mail order and it gets mailed to you, you never got an ultrasound. Statistically, the number one killer of women in the first trimester of pregnancy is a ruptured ectopic or tubal pregnancy. Of all pregnancies, 1 to 2% of those pregnancies will form an ectopic or tubal pregnancy. That is a life-threatening complication. Women deserve better. So every time they send out 100 abortion pills, statistically, 1 to 2% of those women will have a life-threatening ectopic pregnancy.
Well, I think it's interesting, just regarding that, what you've been saying, we've not got too much time, so just in one or 2 minutes, obviously you mentioned abortion being this affront to God, and you've mentioned all of this pain that has come from the abortion pill. In your work, what have you seen in terms of healing from abortion trauma? And what do you think what needs in women do you think need to be met more by pro-lifers to help them heal from abortions?
Well, first, we have pregnancy resource centers, which are available to women. They're available to women when they're facing a tough decision and a challenging part of their life. They're there to help them make the right decision, but they're also there to bring them counseling. Because when a woman knows that she is pregnant, she's taken an action which has killed that baby in the womb, there's a horrible sense of loss. I'm actually giving a lecture in Dallas, Texas, to over 7,000 counselors, that they know that their actions killed that baby in the womb, but there is healing. But pregnancy centers aren't just there to help women make a good decision. They're there to help them with job training, housing, education training, even as far as meeting their daily needs, and to bring the dads into this, because every pregnancy involves a guy. So we need to engage and involve the guys and say, look, this is not a problem. It might not have been part of your planning, but this is an absolute blessing, and we want to help you through that. So pregnancy resource centers, and we have over 3,000 of them here in the United States. They're there to help. And even if a woman chooses the wrong choice, and maybe even a man makes the wrong choice, they're there to provide counseling, but really importantly, forgiveness. Because true healing comes from forgiveness. True forgiveness only comes through the gospel and the blood of Jesus Christ. That's why this is a message that should be have people that are physicians and politicians involved. But a spiritual battle needs to be led by our spiritual leaders, which is our pastors, our priests, and our rabbis in churches.
Oh man, what a way to end that. That was absolutely brilliant. Thank you so much. I could have spoken to you for ages about all of that. So thank you very much for coming and talking to us at SPUCTV.
Oh, it's an honor. You can give me a call anytime. Give me we can do a follow-up show and go into more detail.
Excellent. That's absolutely perfect. Thank you so much, Bill.